everybody. I've been using Zoloft for over 2 years, and I'm going to explain to you exactly how it works, how it feels, and the timeline of its effects and side effects. So to start, I'm going to briefly talk about how it functions. So it's a selective serotonin reuptake inhibitor, which means it blocks serotonin transporter. And serotonin transporter basically acts like the drain on serotonin. It helps remove it from your brain. And whenever you block that, serotonin basically just pools up. And this surprisingly actually is not what helps with mood. In fact, a spike in serotonin like that generally makes you feel worse. And that's because most serotonin receptors, when activated, cause you to be like overstimulated and stressed. How it actually works is it desensitizes your serotonin receptors and desensitizes your autoreceptors, which basically act like the brake on serotonin. So it basically calms down your serotonin activity and increases it where it needs to be increased. Now, on to how it feels. One interesting thing is because of this brief surge in serotonin whenever you first start before your brain adapts to it, it overstimulates all your serotonin receptors, which can actually cause an increase in anxiety and depression in the first 2 to 6 weeks. Until after that, your brain starts to adapt to it, and that's whenever the full therapeutic benefits come in: anxiety relief and depression relief. And it usually feels less of like some drugs, are like really sedating and they just numb your mind out. This one, it acts more as like a dimmer switch. It kind of like modulates your emotions and makes sure they don't get into extremes. Now, the side effects, as I mentioned earlier, whenever you first start, that surge in serotonin can increase your anxiety and depression momentarily. And it is not sedating, as it has slight affinity for dopamine, which actually helps you stay alert and awake, and is oftentimes activating at first. Now, another side effect is sexual dysfunction, which is really common at high doses. It like reduces your drive and performance. And another side effect is when you first start it, as it increases serotonin everywhere, it increases it on 5-HT3, which is mostly in your gut, which can cause nausea and GI issues. So that's basically all you gotta know about Zoloft. Everyone reacts to it differently, so ask your doctor before starting it or stopping it or changing dose. It's worked well for me over the past 2 years. I don't have any problems with it. But one thing you do really gotta watch out for is if you have a history or family history of bipolar disorder, it can sometimes trigger switches into mania. Now, thank you for watching.